Hi, my name is Andrew Williams. I'm a consultant colorectal and pelvic floor surgeon. I work at London Bridge Hospital. Well, that's very interesting, really, because when I was growing up, I never wanted to be a doctor. I wanted to be in the Air Force. Then I went to a careers fair, and they said that because I had asthma as a child, I couldn't be a fighter pilot. And then I started thinking about what I really wanted in life. I've always been interested in science and people and looking after things. So it then became obvious that maybe medicine was the right thing. And it's interesting, as I've gone on in my career, it's struck me that actually, of all the choices I've made, that's probably the best one because it's probably what I'm most suited to. It certainly worked out very well for both me and hopefully my patients. So that's good. Well, I've enjoyed everything I've done, really, from medicine to casualty to surgery. But as you go through, you realize what type of a person you are and how your mind works. So, first of all, the decision is whether you're going to be a physician or whether you're going to be a surgeon. And there's no doubt that my mind is very much more surgically orientated in making decisions, making diagnoses, and hopefully having definitive fixes. Not to say physicians don't do that, but I'm more suited to surgery. So then the choice of colorectal and pelvic floor and proctology is, I find it the most fascinating area. The questions are often very subtle, very complex, very difficult to untangle. Often the solution's not just binary, straightforward, have an operation, don't have an operation, but it's a lot more thought involved, and that I find challenging and really stimulating. Also, you get to know patients more, and I like that relationship. I like getting to know people and seeing them improve and seeing them recover, which is great. Um, Again, it's seeing someone who comes to you quite broken and then leaving them not necessarily fixed, but really in a good place, and their quality of life really improved. And often the most rewarding patients are the ones where you've both struggled the hardest and it's been possibly a difficult journey involving many, many steps, but coming through the other side. Often we part as, well, quite good friends, really, in that we've been through a lot together. And so that's often the most rewarding patients that I treat, certainly. Well, my approach is very much down to earth, plain speaking, and hopefully with a lot of humour. I find often the best way to approach really difficult, sensitive subjects, which are often very, very embarrassing. A lot of what I do is this sort of thing, is with some humour and just being plain with people and plain speaking with people. And I almost invariably find that people respond to that in that you get the best out of them. They can often tell you things that they wouldn't normally expect to be able to divulge to what is a stranger initially when we first meet. But hopefully that puts people at their ease, they're relaxed, they feel comfortable and they feel supported. And that's really important to me. Um, and in respect to that, what I get is I get a little window into someone's personal life, which is quite a privilege because they share things with me that maybe they've not told other people. But hopefully together we can then deal with these difficult problems. I think following on from the last question, really, often I test the water to see how normal they want me to be. Because some people come to see a doctor and they want to see somebody who is a stereotypical doctor. And so I often say to people, well, I can speak doctor if you'd like me to, but I'd rather just speak normal because I think we can then really understand each other and move forward better. So I guess if there is a mantra, it's that, and to do everything with a bit of humour and some relaxed empathy, really.